testing. As a school nurse, we are, involved with our kids that have diabetes. Usually, if they get it at a young age, when they're in elementary school, it's the more severe type of diabetes. So they are dealing with insulin and insulin injections, and they're learning how to manage their own disease. So when a child's newly diagnosed, of course, they're in the hospital several days and they get a lot of teaching from there. And then they come to school. We coordinate with the physician, and we actually have to have physician orders about when to test their blood sugar and what to do if their blood sugar is below a certain level or above a certain level, and how much insulin to give them before they eat. And those kind of practical things, and what kind of equipment to use, whether they have a pump or whether they have injections, if they have a pen. So that's all coordinated with the physician. And of course, communication is just key with these kids, and trying to get them regulated. So we do a lot of phone calling back and forth to parents, especially at first. And then a lot of the kids just have a notebook, and parents will write in the notebook like what they're bringing for lunch and how many carbs are in it, and how many units of insulin they need at lunchtime, whether that's given a shot or through their pump. And then we'll write their blood sugar, what that was when they checked it. And we have standing orders for if it's below a certain point, then we need to treat it before we do anything else. If it's above a certain point, then usually they need to drink water and maybe cut back on their insulin a little bit for lunch, or increase their insulin for lunch. So the notebook works really well as far as communicating back and forth with the parents. And of course, if it's something urgent, then we just call them. Now, what other kinds of things?
So most of the students you work with are really young. Have you met students, are they mostly dependent on you and the parents, or are any managed better than others?
Yeah, you see a wide range. We have, unfortunately, some of the kids who are diabetic, they have other complicating conditions, like maybe ADHD, and it's really hard for them to focus just on even counting up how many carbs they're going to have for lunch so they can figure out their insulin dosage, that kind of thing. So we have to figure out ways to help them do that, and really ultimately it's their disease, and they need to learn how to manage it. So whether it's moving them out of the clinic so that there's not a lot of noise and commotion around them, to be able to sit down and figure out their carbs and figure out their insulin dose, or suggesting, summer camp, diabetic camp. If they go to that, they get just intensive training, and that helps a lot of those kids a lot. We'll help them as they go through, because most of them, they do have to learn how to stick themselves to check their blood glucose. So we start out doing it for them, and then we help them do it, and then eventually they become independent doing that. And it's the same thing with their injections or with their pump.
And you said you coordinate with the doctor as well. Do you keep records of the kids' blood glucose, or is it just them?
Yeah.
And you send it as well as the kids send it to the doctor?
If they ask us to.
Okay.
We keep a record in our medication books, the blue notebook over there. And some parents want us to fax it to them like at the end of the week, so that and then they'll save it for maybe 4 weeks, and when they go and have their doctor visit, they have all that data with them. Okay. Whatever the parents and the physician want us to do.
All right. Thank you.
Sure.
Thank you.